Topping the news at 5:30, at the end of the year, the New York Department of Health reported the state was experiencing the highest number of flu cases ever recorded in a single week. The CDC is now classifying this season as moderately severe.
We're now joined by Dr. Joseph Chow with Western New York Immediate Care. Dr. Chow, you've been here many times. Thank you for joining us again. We appreciate it.
Thank you for having me.
Your expertise is important, and that is despite the fact that you want to know why his voice sounds like it does. That's because of how in demand he has been lately. He's been busy. So how have things been? What are you noticing? Any trends, or are you seeing these surge like everybody else?
We are definitely seeing this surge. We're getting a lot of patients that come in. Majority of these patients are coming in for a respiratory illness. The majority of those patients do wind up having flu. Even though there's still some COVID out there, there's still strep we're seeing, other viruses, but by far and away, flu A is really what we're seeing.
All right, and with flu A, people who are coming in to see you, which of those, or how many of those patients are you sending to a hospital per se? How many are getting hospitalized? And what makes it get to that point that you're like, you know what, you really should go to the hospital?
Yeah, fortunately, the majority of the patients that we're seeing actually do well. Some will need treatment with antivirals. Others, especially if they're young and healthy, if it's young and healthy like you both, generally you'll do fine just with supportive treatment. Certainly the folks that are higher risk, the really young, the elderly with multiple medical conditions, especially if they have difficulty breathing, drinking fluids, if their skin is blue or if their oxygen levels are low, these patients will need to go to the hospital, certainly.
Hopefully before that, it gets to you and you're able to head off any problems. My question is now, because there's so many things going around, you just rattled off COVID and RSV and flu A. What should folks be looking at to differentiate those illnesses? And can you even do that? Or should you just maybe buzz your doctor and say, hey, I might need to come in?
So a little bit of both. You're right. With so many viruses that are out there, they can present pretty similarly. What I found that this season with the flu, it does at this point behave like what we would consider a traditional flu. Pretty rapid onset of symptoms. A lot of patients will say, I was fine in the morning, and all of a sudden at 2 o'clock, it just hit me. Seems like it's coming very fast. Fevers, chills, and really significant body aches. And then not so much, I feel a little bit achy. They'll tell you, I feel like I got hit by a truck. And so these have really been the traditional flu seasons. And at least, the patients that I've seen, they've really presented like that. That being said, testing certainly helps to differentiate between flu, COVID, RSV, and some viruses just won't show up.
Those tests, are they accurate enough? I mean, do you recommend people actually getting them? Because does it matter what you have? I guess it does in some cases.
In some cases, yeah. A complicated question it can be because it depends on treatment also. So for a lot of patients, let's say adults who are healthy, most of the RSV testing could be usually for the kids. For adults, it probably wouldn't change very much. COVID and flu, there are some time frames where flu can be treated within 4 to 8 hours typically. COVID, you typically have a 5-day window. But again, that's also if you're at higher risk. So a lot of answers to that question, but testing can be helpful, yes.
Warding it off, your best advice for that?
Never too late to get a flu shot. So for everyone who has not gotten it, please make sure you get it. A few other things, look at your hands, wash your hands. If you're gonna cough into your elbow. If you're gonna be in crowded areas, try to prevent that. But if you have to, you may wanna pull out your trusty mask again, especially if you're gonna be crowded indoors. So those are a few of the general things, pretty tried and true that we've said over the seasons, but still very effective.
I feel I am seeing more and more people at the supermarket, and in public places with masks. And, you always have to wonder, well, is it you that is sick, or are you just trying to prevent sickness? You never know, but certainly people are protecting themselves, so that's at least good. You mentioned the flu vaccine. We had on earlier in the show Dr. Stephen Turkovich from Golisano Children's Hospital of Buffalo talking about the changes in vaccine schedule. And while we're not going to ask you about that here, I am curious if, because of all of the discussion that we've been hearing recently over the past year about the vaccines and their efficacy and things like that, what are you hearing from your patients when it comes to vaccines?
Yeah, I think there's more questions about the vaccine. Do I need to get it every single year? How efficacious is it? Keeping in mind, even if the flu shot is not a, quote, perfect match, because the flu shot's developed months ahead, viruses can change on the dime, and so you may never be able to match it perfectly. Even if it's not, quote, a perfect match, much like this year, the subclade K is probably not the perfect match for the vaccine. even if it's not a perfect match, there's still definitely benefit from it. And so I usually tell patients it's, like the rising tide raises all water. So even if you get it, it still helps prevent against the bad things, hospitalizations as well as death.
All right, Dr. Chow, we appreciate it. Thank you so much.
Always great.
Thank you
Appreciate
for
it.
having me.